Sorry, guys.
Like to be off the clock.
Yeah, for real. Well, welcome to Off the Clock, a clinical research podcast. We're so excited to be here today. Grab a drink, grab a snack. I'm not drinking today. Yeah, you don't have to drink every time you want. No, the table. I'm kidding.
No.
Well, sit back and relax and just enjoy the podcast. Make sure to leave a comment, like, subscribe to our channel. We're also going to be starting to stream on multiple platforms. We're really excited for that.
We're trying new stuff and trying to get out there to more bigger audience.
Yeah, we want to try to bridge the gap, like I always say. Yeah, and just kind of be out there a little bit more to help more people.
Yeah.
So thank you so much for being our loyal watchers, I guess. So yeah, let's get it.
What's up, how you doing?
I'm good. How are you? How's listeners?
Okay. For now, I want to give you the floor so you can explain what you're saying. Departure from Icon. So, floor is yours.
Okay. Well, as many people know already, I did resign from Icon. It was a decision that I took lightly, but it was a decision that I felt like was very necessary, not just for myself, but I feel like for my kids and their future. I am really, really passionate about clinical research, and I kind of want to like reach out and like expand. And I felt like due to some things that happened also at Icon, I just felt like I wanted to just start something on my own, and like change my life, change my kids' lives, just kind of change other people's lives too, if you think about it.
What's good is that you got the sponsor side experience that you can bring to the table to whatever your next step is.
Yeah. Should we review the list?
Not yet.
Okay. We're gonna wait, so you gotta stay tuned throughout the episode to hear towards the end.
Don't you fast forward either.
I guess they could if they want. Right? Yeah. Well, today's conversation, I think it would be good to talk about
Study growth.
yeah, business development and all that. But I think that's a really good topic to talk about because I feel like there's so many people out there that
It's got such a bad name for it.
yeah. I know when we were working with your mom, her thing, I remember we would hire people to do weekly, and we would go a whole year and we wouldn't get one study. And if we got one study,
It was
like
something that you
really
couldn't do.
bad. Like you couldn't really enroll anyone. Yeah, it was like
The bottom of the barrel.
yeah. You remember like it was terrible. And like I feel like
Not mentioning
it's been so hard, like as a society, it's so hard to find really a way to get studies and kind of almost, try to believe the word of people and see if it works because it's just something
Or
that's
you
so hard.
give them a chance.
Yeah.
They use practice. But it's
Yeah.
like hesitant now.
Yeah.
It's like car business or car salesman. Everybody's like, or mechanic, car mechanic. Everybody's like, oh,
Yeah, they
you know
think
what I
that you
mean?
can go there and make your car work.
Yeah,
so you can
on
come
purpose.
back. Yeah.
It's kind of like that. Bad name. But there's been, individuals.
Yeah. I mean, there has been.
There is, but you find the right one. One you're gonna want to stick to. With them,
Yeah.
So,
And did you know that on average, study brokers get small to medium size, which is most of the sites that we're needing. They give small to medium size about 2 to 5 studies a year. Yeah. But if you think
and
about it,
that's a good study program.
yeah.
It's not like
Yeah.
one of these bottom
Yeah. But if you think about it,
at least the average ones.
like the return on investment is pretty high if you just get one. But depending on the price, obviously, but
Yeah, but depending on how long they're taking to get you.
yeah. So like one good study can get you $500,000. So it's what it looks like it's like.
Just look at all the expenses and stuff, so it's not
Yeah.
a problem. But
Revenue one.
yeah.
Okay, yeah, so what do you think is like the worst thing people think about like study brokers and site networks? As a site, on a site perspective.
from the site perspective, we're like going at another one of these people that are going to want to take their money, not get us any studies, or just off give us studies that
You can get it
and,
on.
get better studies out of your own, without the study, but at the same time, this business you kind of need it.
Yeah.
You know what I mean?
Yeah, because they're kind of still getting your name out there.
It's
Kind of still marketing.
you kind of need it because
Yeah.
anything that bring in more money, more studies, more it's always what you want in business.
Wouldn't it be better, like, for a site, like, when they have a city broker, and, like, let's say they do live on, like, a physical site, wouldn't it be cool, like, if that city broker would kind of help them, like, find patients, like, a patient or something? I feel like it would be difficult, but, I mean, like, it's possible.
But they do such a bad job on their own. You don't want to give them another task that they have to do.
Okay.
You know what I mean?
Yeah.
So it's kind of like a hit or miss.
Yeah.
Like
But then on top of that, right, you can literally have someone on staff doing BD for you and still kind of like it.
Yeah.
And like you're paying, because BD, they get paid pretty good.
Yeah.
Like they get paid more than it's like working.
And they can do it for multiple sites at the same time.
Yeah, and they can do it remotely, so they don't even have to be on site.
So it's
So, but I feel like the cost is so high when you have them like dedicated to just your site. Like you have them on like payroll.
You have someone like that on the table, it starts doing pretty well already.
Yeah.
So, but how find these good ones? I mean, is it worth going to a bunch of them to find a good one?
Well, when you find them, it's really hard. And you know what I have noticed? That sponsors are kind of going more towards like site networks versus most, because it kind of like makes their life a little easier to them.
I would imagine so. I mean,
Yeah.
if you have a site network, right? And they have very good reputation.
Yeah, because the
They
reputation.
make sure that the sites that are part of the network, those good work curated sites. Even you can have like a site that is maybe a good site, and they might need a little maybe
A push.
a little push or a little in the right direction, and be great site.
And I think what helps sponsors is like they kind of have, well, this is more towards like basketball, but like they kind of have like a point of contact, right? So like if the site is in data or has action items or maybe it's not responsive, it kind of gives them that extra layer of support.
Yeah. All right, they're not. They can't get a hold of them.
Hey, can you please help?
Hey, yeah.
And not all SMOs do the budgets for you. Like there's a lot of SMOs that let you keep whatever it is, and that's your money.
But a lot of SMOs also take from your study.
Your budget.
Yeah.
Yeah, I know there's one that's like a site network. I don't know if they work as an SMO because the lines are very good for me. Like what a site network and
Yeah,
it's super good. I feel like it's the same thing, but people just think that one of the names sounds better.
Yeah, maybe the SMO might be more towards like they have to say that like a part ownership or something.
No, not all the time, no. But I think there's one that they don't even let you see the budget. Like, they negotiate a budget with you, but then they have another budget with the sponsor, but then you can contact the sponsor regarding payment. You have to contact them.
So they're getting stuff off the bat.
Exactly. So then it's kind of like
It's
a little shady because I feel like there should be transparency. Right?
Yeah, because it's a team.
Yeah.
We're not, it's not you against me, it's a team. We're all working together.
Like it's okay that you're making money.
Yeah.
But
That's why you're part of their
Yeah.
network, for everybody to make money. Nobody does work for free.
So it's like it's funny because they kind of advertise it. And okay, so this is I think what gets me, right? They advertise it to the sites that it's free for them.
Yeah.
Right?
But in reality, they're
But
skipping off the back.
in reality it's not. But
They're
then on
skipping.
top of that, they're double dipping. Because they're also charging the sponsor
Oh, it's
for their networks. Yeah. So it's like it's one of those things that's kind of like,
wasn't even aware of the charges.
yeah, they can charge the sponsor. So they literally double dipping. Like that's what I think. Because it's like you're telling someone you're gonna help them get studies, and then you're telling someone you're gonna help them get sites. But then you're gonna charge both of them. Like
Yeah.
something's gotta be, like,
But
there has to be a little dignity.
it's been going on for a long time, so
Yeah,
it's accepted, yes.
yeah. But I feel like what's always made me hesitant, like, before I was getting into the website numbers, is like, what if one site network or the site network starts getting a reputation that they're not good?
Yeah.
They're big, but you're part of it.
But that's
So
why,
do they start like they
That's
kind of
why-
start like putting you in that same category because you're part of the same network? It's like I feel like you have to be so careful what site network.
you gotta make sure you pick the site
Yeah.
that, that are good sites and reliable, and you have to, because if you're like reaching
There's
out
some
to a
site
site,
networks that don't care. They just sign everybody up and they're like, oh, we just get your studies, you handle everything on your own.
but that's more like me.
Yeah, but
It's about the
they call it a site network.
Really?
Yeah. And it's like they can ruin your whole
What if there was a site network where the site network has sites, but they screen those sites, they vet the sites, make sure that
And,
they
like,
do
minimum
they're well,
requirements.
and they have minimum requirements.
in their
Like you
contract.
have to do this. Yeah, exactly. If not,
Yeah.
they're gonna get
I feel like that also eliminates that
yeah.
from the
Which
network.
what we're trying to, what you did want to separate is the good sites from the bad sites, because there's so many sites out there.
Yeah.
Then it's automatic for a sponsor. It's hard to tell. if
It's just
you never
it's
worked
hard to
with them.
even contact all of them.
Yeah, sometimes you gotta.
Or what about when you're a new site?
That's
You're not in their system.
That's tough. I
Like
know.
you're not in their internal system.
So hard. You almost need to find a site network or a VP if you're a new site.
I feel like it
Unless
would
you-
help so much.
Unless you've been in the business for a long time. And you have
Yeah,
connections
your
already.
contacts, yeah.
Yeah.
And you know what else people do? They sell like their Rolodex. Yeah, I swear for like thousands of dollars, they sell like a certain amount of their Rolodex.
But
And then they're like, oh, I can't promise you they're still active.
yeah, I was just gonna say that. I mean,
Like
people that work for sponsors and stuff, they move around from sponsor to
All the-
sponsor so
especially
much
when they
that
are.
man, most of the time you get a contact from someone and they're not even there anymore. They're not even working.
especially with all the layoffs. How do you know? And people
You know?
you know. That's definitely where we have to get that. Right?
You never know.
But yeah, I think
You know?
sorry.
Oh.
I think it's like something that like should consider, should take into account, like be careful.
If you're a site and the site network that is trying to recruit you is actually requiring you to be on time, next day, budgets and, right away, responding right away. If the site network is actually requiring that, that might be one of the better site networks.
Yeah, and I feel like also when they have like constant contact,
Yeah.
like they have their line of communication open, but also like I feel like a lot of stuff that was like monthly or quarterly talks, and it's like, okay, but are you really keeping up with the site? Would you really care at the site like that?
Yeah,
You're
exactly.
to meet with them once a month, like I don't know.
What if the site network had bi-weekly meetings with all of their sites?
That would be,
Everybody's on the same page,
yeah.
transparent.
I really feel like a site network should also visit the site. How are you signing?
I
to
do,
come up?
and without going into
You
the
don't know
site
the
and checking
facility.
the capabilities and, and like you mentioned, a lot of feasibilities
Are not
not true.
true.
But a site network, if, let's say a site network has a site in another state, they should visit the site before they actually sign. And actually, they can sign the contract personally. We're here for you. We're not ghosts. We're not AI. You know what I mean? What if, we'll set up a call, on Teams or whatever. And then after that, goes to the next step in the process,
So wouldn't that kind of?
going to the site and checking the site out, making
I
sure.
love that idea.
doing the-
But to delay the contract signing, it's debatable for me just because like if you have like let's say your site network and you have a study that's going today or that needs things today, but by the time you go to the site, that study might be gone.
Yeah, but the good site network is going to have more study.
Yeah.
Pipeline, and on top of that, you want to have somebody who's going to sign a contract or something without knowing.
What about if you do a virtual tour, right? And then you can sign the contract, but then you still visit.
And you still visit around. Yeah, that can work. That's good.
Yeah, that would work.
It's a very good idea. So there's
Yeah.
reasons.
So
So
like
for
have
your blind data,
but now, if you're doing a site network, I know that some site networks charge per study, and charge like monthly, and some do both, whatever. If you're doing per study, do you visit the site? Do you do
because
virtual
you're
tours?
technically just
But you still have it in your network.
somewhat of a
still
network.
have-
They're
They still
not.
have like minimum
They're not
requirements.
part of your network. Maybe the monthly has a different contract requires different certain amount of things, and then the per study sites have a different contract with a little bit less requirements. You know what I mean?
Like maybe less required, and then you don't have to visit the site.
You don't have to visit,
But I feel
and
like
maybe
you still
not
have to kind of-
everything. You know,
You still
so
kind of have to keep that way, because you're still presenting them like your network.
but that's what I'm saying. You have less requirements than the ones that are per month. The ones that are per month, you work with controls.
Yeah.
You know, and tabs on it. You know what I mean?
Yeah.
The month per study are basically
What if?
like that's like the one.
Yeah. What if you ask for like monitoring, say, follow-up letters, and you can see like, how they're actually doing it?
I'm not sure what the regulation is.
It doesn't have any like professional maybe. Yeah. Well, I think in the contract I kind of think
And
about
their brother.
yeah, when you sign a contract with a site, it should include like, okay, like it's your information, your proprietary information, but now we're part of your contract with you. So it's like the same thing as an auditor. Like when you hire someone to audit your terms, there's a contract in place with the NDA, the confidentiality, whatever there is, because they have to go and check your terms, right? So wouldn't it be kind of yeah. Yeah, I think looking up regulations for that. Because that would be really good to know how your site's doing.
Right? That's good indication.
I know for the same study, you could definitely do it because you got them to study, like you might. I know that you can for sure do it.
Yeah.
Yeah, but yeah, I get what you're saying. If it's not a study you got them, yeah, maybe. I can see where you're saying. Yeah, but it would be good to be able to do that.
Yeah.
Right?
It's the
Because
one
then you
that
could really see what they're
what
doing.
kind of
You can see how long the action items have been open.
yeah.
That's
The
really
one thing that bothers me is those queries when they we have 30 days, 60-day queries. I mean, how do you let that slide?
But
I mean, you know this more than anybody.
yeah, the data management is
So
also
crucial.
or
You
else
need to
clarify.
You need to have good data management.
Please confirm or else clarify. And it's like it's there. What do you need me to clarify? So they do have a lot of like annoying triggers too, you know?
Yeah.
Because a lot of it, I don't know if you know this,
But
but a
if
lot of
it's-
it is auto queries.
If it's an product or something simple, why not trigger that way? Why wait 30 days?
Oh, I agree. But okay, so
Those are the kind of sites
I
that
remember-
site network is not want.
yeah,
Should
but
want,
I
you know?
remember when I was at a study, we had a study that was like, I want to say over 200 patients, and they changed something. They changed something in the metadata or whatever, and all of a sudden it queried every subject for that. Every subject, and you like it's hundreds of that's a lot. And then on top of that, you're still seeing patients and all that. And then there's other times where like every time you enter a weight, it will say a query with auto populate, saying like that it's incorrect. And it's like there's no way that's incorrect. And they're like, oh, I remember when I was at a CTM, and I thought there was a study that was for kids, right? So the people took the weight, and every time we queried them, oh, there's no way the patient can wait this little. If the kid's a baby, what do you mean? time.
That would drive me nuts. I would have called them and I fix this week.
So
This is
the thing
not-
about it,
This is a study for kids.
why do you have that trigger?
Why? Yeah.
Yeah. There's been some things that have been like, that doesn't make sense.
Doesn't make sense. It's just that nobody wants to sit there and actually change it for the
Yeah.
for a specific study.
Yeah.
Like a study required is for kids. Why are you gonna have the same
You should put the parameters based
parameter?
on,
Yeah,
yeah,
yeah.
on the studies, like,
Especially
demographics.
stuff like that.
Yeah,
You know?
yeah.
Because it's so time consuming to have to go back for something that is not wrong.
Well, what do you think about what if a site network offers like help,
Like consultation.
like a research assistant, and you add them to the database block and go do data entry or enter queries
But
if
make a
you're backed
source,
up,
make a source document.
source documents if you're backed up. It might be an extra cost and stuff, but I think that's a good idea.
Or that I guess would be part of the monthly thing, depending on
Depending on the price,
you know,
yeah.
and what time.
That's not a bad idea. I mean,
It would have to
depends. If they
depend.
have
It might
paper
be
source,
it
or
might
they
be-
have electronic source.
if your site network,
Yeah.
you can't get sites that don't have the source. This is the future. This is
Or
streamlined, and if there's
you kind of have to like recommend it. Like,
recommend it, or if they don't want to, then I don't think they're a site. They're a site for a real respectable, site.
Yeah.
You know what I mean? Because
The thing is like sometimes,
these sources are the way to go.
yeah, but sometimes implementing it can cause issues because you're still learning. So like sometimes, like the audit trail, because they have audit trails and stuff like that, it looks like you're not doing the right thing. But it's just like sometimes like you're just not sure, or you're learning, or you didn't know that you had to do that button or
but-
whatever.
There's going to be a time, probably pretty soon,
Oh, it
where
is.
it's going to be required
Yeah, it
to
is.
be e-source.
Well, I'll
So
tell you
why
something.
not start doing it
Yeah,
now?
I can tell you.
There's a site network. There's a site that doesn't do e-source. If they're not willing to upgrade
Yeah.
to do electronic sources, source docs, then I don't think they can do it.
Well, I can tell you that.
They're not willing to adapt.
I can
Sorry.
tell you that I've seen a lot of sponsors moving more towards sites that allow e-source and that have that capability, and that's fine. Because it's a lot of money saving for them. Right? So guess they don't have to go on site to do that.
Yeah.
To monitor, they can do less on-site visits.
Yeah.
That saves money. They can any documents that they need, like a lot of
They
times
can go in there.
you have no idea that a sponsor or a CRO is getting audited and they need documents right away, and you have no idea, right? So like they're asking the sites for the documents, the sites are like, oh, I already gave this to them. Look, they really need it because they're getting internally audited,
Yeah.
right?
But if it's on e-source,
But if it's e-source,
they can go in there.
it does not matter. All they have to do is go in and grab it. So it's just like it's
So much
so
more efficient.
helpful for
So
sponsors,
efficient.
and they're really moving towards that.
I mean, you're a coordinator. Isn't it easier to
Enter it while
enter
you're
into
there. Instead of having to
writing and then you can write something right, mess stuff up, can't read your own writing. It's not,
Yeah, you're fast.
Yeah, because you're
You're
trying to
writing
you have
fast.
some patients waiting and you're doing them out of time. And you still, you have some patients waiting, but you still need to take the proper amount of time for, whatever that protocol demands,
But don't you feel like this is what BD, this is what site networks, this is what study brokers should be, the information they should give sites to help them be more efficient. Like I feel like it should be
But I don't know,
part of
that's more of a study broker type of thing.
or site
More of a
networks. though.
site network with consultation capabilities on hand.
I feel like if
Or,
you're,
like a monthly,
but I feel like you're a site network and you're putting your reputation or your name
Yeah.
behind these sites. You
Which is why
should
you have to
want
vet.
them. You should want them to be the best that they are.
Exactly.
And I feel like these kind of things like suggesting these implementations and things that other things. There's a lot of things in a site that sponsors look for, and like being able to like implement it and help sites be better and be better for the future, long
That's what we're
term.
talking about, being able to adapt to
Yeah.
new things coming
I
like
feel like
AI.
that should be something so important for
It has to,
sites
and for a site
networks.
network
Yeah.
new site to their team.
Yeah.
You know, because it's a team. There's no.
We all should be a team. The
It's a team.
sponsor, the CRO,
Yeah.
the site
We're
network,
all
the
working toward the
site.
same goal.
Yeah, and the
Giving
goal
their
is
information, the proper, right
the goal is
information,
patients, better life with
And-
well-being.
and making sure you have all the right data so that the pharmaceutical companies aren't wasting all these
Yeah.
billions of dollars.
And maybe
And with bad data, people are
the medication will be cheaper because they're spending less money.
exactly.
Remember, it's a ripple effect.
It is
If
a-
the sponsors, if pharmaceutical companies have to spend more money to get a drug approved, they're obviously going to charge more because they spend more money. There's more investment. So it's like almost like think about everything kind of like in a business development. Your phone went off. Oh, my phone. Oh, maybe somebody was calling. Anyways,
Anyways,
my phone. No, it's lost. Oh, okay. Well, so I think that's something really important. Like we have to understand that everything's a business. A site is a business.
it's a business.
A site
Yeah,
network is a
it's your
business.
sponsors are business.
Sponsors are business.
Exactly.
CROs are business. And like they're gonna try to do what's best for their bottom line cost.
Of course.
So being able to understand that I feel like also helps put you as a site in a better position to do better work.
What is important, I think, for a site network is in that reputation that they have
And you need your sites.
A1 sites, A1
And that's your
sites.
key.
You have to get to exactly. You know, where there's no site, two sites are pretty close. There's no
Competition.
competition. We're a team. If they're both part of the network, they're both teams. It's a
Actually,
team, you know,
think about it. You can kind of
we can
use that as an advantage.
work together.
Yeah, make sure you're not getting page,
Exactly.
things like that.
That's a good topic for another day.
Yes.
How to how to come up with a system to find out if a patient is duplicate or not.
Yeah.
You know
I
what I
think
mean?
we should talk about that.
That's another topic. Yeah, but that's a good topic for
Yes.
another episode
So,
because that's a big deal.
yeah, I think we spoke about a lot right now and like we gave a lot of information on that network and on the city brokers and how to really choose the right one. Now, do you want to Well, we just want to announce that it's been a very huge month for a very long time. I'm very passionate about helping sites and about helping clients and sponsors be able to get their site to run the right way and the most efficient way, not just procedure-wise, but also like financially. So we want to announce that we have opened up a site network. It's really new. And we're really excited to bring this out to everybody and to invite sites to apply.
We're going to try to separate good sites from bad sites and turn those good sites to great sites, elite sites.
Yeah, we want to help like the smaller sites that can't do great jobs.
Yeah, that they
can,
don't know about this.
and that are if they're just having a hard time finding studies. And we want to help them grow and like kind of give them the perspective of the sponsor side, CRO side, and just help them get themselves out there. You know,
Yeah,
like,
but
just be better.
the best thing for that, for those kind of sites, is joining a site network that has a reputation for elite sites.
Yeah, and that they
For everybody, all the sites doing great work right away. Data entry is on point. You know, everything's on point. They respond to emails.
And
That's
I think the best part like is like finding a site network and this is why what we feel like what we're giving is different because we really have research experience.
Yeah.
We
And on
own
the sponsor
sites.
side,
Yeah, we own
site
sites.
side, yeah.
We've had struggles with research. We went through COVID.
Well, don't worry. There's still going to be site sponsor versus sites. So,
Yes, because I'm still
It's
pretty
still-
much on the sponsor side.
yeah, she knows the sponsor
Yeah.
side. And those
Yeah.
site side. She knows the site also, but she's got the sponsor side. So it's
Yeah.
going to be, we're still going to have our sponsor versus,
Yeah, but I
Sites.
like that
Yes.
we're creating a site network that can give sites both perspectives.
both all perspectives.
and then knows what they're going through.
Yeah.
Like, and knows the struggles of being a site owner, a site director,
Yeah.
and knows the struggles of BD, and knows the struggles from the sponsor side finding the
Now, on the sponsor side, what do you think needs to be? So, have a site network that you can call and say, hey, look, I need this many sites for this. And the sponsor knows that they're going to do great work.
Yeah.
And you're not going to lose.
Yeah, and that they have a point of contact that knows their side of things.
Exactly.
And knows the struggles of managing the
What
site.
did that mean for sponsors?
Yeah, it should be. I
So,
agree. But
Let's bridge that gap, guys.
yeah, that was the whole purpose of bridging, like what we wanted to create this, is because I started doing that newsletter and I felt so passionate about what I was talking about, and then I was like, how can I make this happen? How can I bridge the gap?
Well,
And we're doing
now
it
we're
now.
doing it.
So, do you want to announce the name? All right, so guys, our site network is called Twin Mastery. We are really dedicated to providing mastery service, not only to sponsors with our sites and with other consulting services like auditing and things like that, but we also want to provide mastery service to our site. And
to the sponsors.
yeah, it's that. But either way, like, and just know that we want to be an extension of your team.
Yeah.
We want to.
We don't want to own any part of your business.
Nothing.
All we want to do is we want you to join our team.
Yeah, give her a fair.
We
Because
are-
we're family.
Yeah, simply.
Yeah, and just give her her family and let's all grow together and make this